Well, maybe will you tell me when I'm about 10 minutes into it, Aris? Hello? Will you keep an eye on the clock and tell me when I'm 10 minutes in, will you? And then I've only 5 minutes to go. Okay, good evening, everybody. It's good to be here. And I was here. I was just sitting outside. I didn't realise the session had begun, so apologies. I don't know how much I've missed. I'm going to, in 15 minutes, just really give you quite a different picture to what Constantino gave you. And I'm going to briefly outline the extent of the crisis in Ireland, the impact of the economic crisis on the health system, and then briefly some of the challenges ahead. And while our countries have experienced very deep economic crises, I think you'll see that there are differences with how they're manifesting themselves at a country level. Just briefly, we talk all about in Ireland, we talk all about the economic crisis, and yet there's been a lot of analysis done showing that it's not just an economic crisis, it's a fiscal crisis, it's a banking crisis, it's a social crisis, and it's a reputational crisis. And I think probably that reputational crisis resonates with Greeks as well. And also with one of the dilemmas in Ireland is we went from having this raging, bullish economy, and 10 years ago I was going to conferences and people were going, what are the secrets to your success? And I was going, I don't think we have success, but... and so we've gone from great success to huge failure, and very quickly. So we had growth rates, continuous growth rates in the early noughties of 5%. And then in 2008, 2009, there were minus 7%, I think, in 2010. I think this year we'll have, the government keeps boasting of positive growth rates. I think it's going to be 0.3, 0.4% for 2012. And also we went from virtually no, or the technical definition of no unemployment, to 15% unemployment in a 3-year period. And this culminated with a bailout from the Troika exactly 2 years ago. And the cumulative amount of money that's been taken, actually I was reading about Greece on my way here today, and actually it seems quite small fry what's happened in Ireland, although it doesn't feel like that if you're there compared to what's happening in Greece. But there's been 24 billion taken out of the economy through increases in tax and cuts in spending, and it's about 2/3 cuts, 1/3 taxes. And we had a budget, and the budget for next year was announced last week with an additional 3.5 billion coming out through increases in tax and cuts in spending. In terms of our health system, we have a pretty odd health system that doesn't fit into normal models of tax or social insurance models. It's largely tax funded. It's not universal. We've no free delivery at the point of access. One of our big mistakes when we got freedom from England and Britain was that we ignored their move towards an NHS and went down our own much more negative road in terms of health system. So we have this very complicated mix of public and private care, traditionally a lot of Catholic providers or religious providers within it. And a lot of perverse incentives that encourage the private provision of care, but obviously that private provision of care is only available to those who can afford to pay it. We have quite a good sort of pro-poor measure in that if you're on a low income, you get a medical card, and this medical card will more or less get you free access to GP and hospital care and drugs. The problem with the public system, while this has been largely maintained with a few exceptions that I'll talk you through, the problem with the public system is that half or nearly half the population have private health insurance, and actually that's been quite resilient during the crisis. But if you have private health insurance, not only can you get private health care, but you can skip the queue into the public health system. And also your care, your private care, is subsidised out of public money. So public patients, the poorest and the sickest, fare incredibly badly in the Irish health system. And then the other 2/3 of the population who don't qualify for these medical cards or free care on the basis of need pay out of pocket to go and see their GP and to pay for drugs. We have a hugely underdeveloped primary care system. It's very much focused on hospitals. There's been endless primary care strategies, but consistent failure to deliver on them. We had this huge quadrupling of investment in the public health system from $4 billion in 1997 to $16 billion in 2007. And yet, so obviously this was during our boom, but what we saw was this sort of throwing up money into the health system, no attempt to introduce a universal health system. We had a centre-right government with a very neoliberal Minister for Health, and this very steady and silent but effective privatisation of huge aspects of healthcare. And within a very short period of time, from being mostly public or voluntary provision, now 2 out of 3 nursing home beds are in the private for-profit sector, and 1 out of 3 hospital beds are in the private for-profit sector. We hugely overpay our doctors and our health service managers, way beyond any comparator across Europe. And we are the highest spender of drugs, and we pay more for drugs than any other OECD country. We have a pretty poor quality public health system. So despite this huge investment, we didn't do much to improve quality. And ironically, the quality is improving now that we've begun to take money out of the system rather than when we put money in the system. And also, we have this growing ageing population, and contrary to Portugal, we've a baby boom. It seems like the Irish reaction to the economic crisis is to go to bed and produce more children, because we're every year on year, and we have the highest fertility in Europe at the moment. In terms of the impact of the crisis on the health system, 2008, the health system, an embargo was introduced on staffing, but the budget actually increased in the first year of the economic crisis. But that was partly because the government had its head in the sand and was completely ignoring the economic crisis. But since 2009, there's been $2.5 billion cut out of the public health system, and in 2013 there'll be another 750, 800 million coming out of the system. So it's back down from ballpark 16 billion to 13 billion in a 3-4 year period. So it's a huge amount of money to come out of the system alongside this growing ageing population with greater burden of disease. One of the key mechanisms of taking money out of the system was to cut staff, not hire new staff, to cut pensions, nothing like what has been experienced in Greece, but significant cuts, and reductions in staff numbers. And yet, during this time, while there's been less money and fewer staff, actually year on year, the hospitals have managed to provide more care to more people. And that has happened not because of the crisis, but because of these clinical care programmes that got off the ground sort of 2006, 2007, but we're only beginning to reap the benefit of them now. So shorter lengths of stay in hospital, much more same-day surgery, much more multidisciplinary team working. And we're continuing to see the benefits of them, even though we've taken huge amounts of staff and money out of the system. Another key mechanism of reducing the budget is increased out-of-pocket payments, and they're very high. Like, to go to an emergency department in Ireland, you have to pay €100. To go to a GP, there's a story recently that the Troika, that the EU, the IMF, ECB didn't pay much attention. There was no conditionality around the health system for our deal originally. And then a Belgian who worked for the Commission got sick while he was in Dublin, had to go to the GP, and was outraged that he had to pay €60 to go to the GP, and then he went to the chemist and he had to pay €55 for his drugs. And the next time they came back to Dublin, they wanted a meeting with the Department of Health to work out about these high costs of healthcare. So there's significant out-of-pocket costs, and increasingly government transferring those costs onto people. And the people it hits most are the people just above that 40%, the people who don't get those medical cards, who tend to be low-income workers, who have also been hit in terms of the money in their pockets. While the hospitals have been providing more care to more people and increasing their efficiency, there are cuts to key services. And as I've said already, we have a very underdeveloped primary and community care service, but there's this increasing emphasis about shifting care out of hospital into the community. And a big part of that is about home help, about supporting older people and people with disabilities to live in their home. And yet, what the government does is the exact opposite to that, because it's easier to cut home help hours than it is to cut hospital care. And so this year we had 2.5 million fewer home help hours in the community compared to sort of pre-crisis time. We had a change of government connected to the crisis in 2011. But really we got, the same old fellas, just with slightly different coloured ties, but we got a centre-right government replaced by a centre-right government who've continued to a coalition government, although they are in coalition with the centre-left government, but it's hard to see that. And they have very much continued the austerity policies of the previous government. And yet their health policy was to introduce universal access to healthcare through an insurance model. So this was the first time in the history of the state that any government had been promising to provide universal access to care on the basis of need. And one of their pillars to that is about free GP care, because obviously having to pay €50 to go to see a GP puts people who need care off. And yet what we're seeing, and they're 20 months in power now, is just this inability to deliver on their key commitments. So they were meant to provide free GP care to 80,000 people with certain illnesses in March of this year. They haven't done that. They promised they'd withdraw prescription charges for low-income people. They haven't done that. And in fact, they've promised to cut doctors' pay. They haven't done that. They promised to cut the pharmaceutical budget. They haven't done that. And in fact, they've come in 400 million overspend for 2012 and are getting their knuckles rapped significantly by the Troika. Aris, I must be on 10 minutes now, am I? How's my time?
Yeah, exactly.
Okay, no, I just need 2 more minutes.
No, anyway, you are at the crucial exactly point of the...
Okay, no, I have 2 more minutes. I'm nearly there. I was just making sure you were listening.
I can give you 3 minutes anyway.
So in terms of the challenges ahead, there's this consistent government mantra that we need to provide more, we need to do more with less. And the public health system has managed to do that over 4 years. But I think all the indicators are it's on that breaking point now, that there comes a point where you can't do more with less, that you have to do less with less. And certainly any international observers or indicators would indicate we're at that point now. And another challenge is that some progress has been made in quality and efficiency of care. And how do you hold on to that progress, transition to this universal access that the government wants or is promising, and at the same time take hundreds of millions out of the health system? And I think most people would tell you you actually can't do all that. And I think there's beginning to be a discrediting of the government because people just don't believe them anymore because they haven't delivered on initial promises, and this seems harder and harder to reach. There is an absence of capacity and leadership in the Irish health system. We have an appalling track record at developing health policy and implementing health policy, and I would think we managed to get the worst ministers for health ever. You know, I don't know what we do to deserve the ministers of health we get, but the current Minister for Health has been mired in controversy since he came in. He's a GP who owns a private nursing home, who hand selects new primary care centres in his own constituency. So there's a lot of controversy and allegations of political interference with the minister. And I don't think it's credible to take another $750 million out of the health system without acknowledging that that is going to impact upon patient care when that's what people are experiencing day in, day out. But that's very different to the rhetoric of the government. And they have failed fundamentally to acknowledge that, like in the budget last week, they didn't really give us any detail on where that $750 million was going to come from. except one or two items they detailed, and one of them was increasing prescription charges for the poorest and the sickest. And then, so for the 40% with free medical cards, they now have to pay more for their prescription items. But for the people who don't have medical cards, they now have to pay up to €144 a month. So these are people who are sick, who need medication. That's a huge amount of money out of anyone's pay package. And they have failed to acknowledge that their measures are hitting on the sickest and the poorest. And while there was some optimism about 2 years ago that we had a new government with a new health policy, I think that's wearing thin very quickly. There we go. I'm done. On time.